On a global scale, government and health officials have implemented strict guidelines for citizens in order to limit the spread of the coronavirus. With restrictions on travel, public transportation ridership in a number of cities has decreased in an effort to flatten the curve and mitigate the spread of the virus. Journeys on public transit vehicles saw a decline in cities worldwide. However, public transit remained an essential service during the peak of the pandemic, as essential workers utilized public transit daily to commute to work. As restrictions are lifted and cities start to return to the new normal, ridership on public transit has started to return, creating the need for new strategies around public transit to be implemented. General practices have been implemented in public city spaces. Wearing a mask, social distancing, and proper hand washing and sanitizing are enforced practices for citizens when interacting in public spaces and transit. Urban planners can supplement these strategies with short and long-term responses to the issues posed by the pandemic. Technology is helping to manage and mitigate the spread of COVID-19. Digital transit tracking apps work to support pandemic mitigation efforts by tracing the movement and flow of passengers using a digital app across a variety of public transit services. Trace Together is a digital app developed by the government of Singapore, which requires all users to share contact information. When a user tests positive, the app identifies potential people who have been in close contact with that person over the last 14 days. The access to personal information and privacy risk of these apps have proven to be a contentious issue across the globe, which many are working to address. There have been work towards creating apps with minimal personal information based on ID numbers to address privacy concerns of users. Other apps are helping to collect and disperse information to people in a short amount of time. The City of New York has created 2 transit apps specifically for COVID-19 and public transit. One app provides information for the Long Island Railroad commuter train, and the other app focuses on the bus system. The 2 apps provide information to riders on how many people are currently on the trains and buses. The bus app provides information on how many people are waiting at each bus stop, and the commuter train app shows riders which trains have available seats. Providing the information to the public allows riders to reevaluate their travel plans or map different routes based on the time of day and numbers of riders already using the transit system. A short-term solution implemented by a number of transit systems to help combat COVID-19 has been limiting or making changes to service schedules. Limiting passengers on transit systems, as well as creating more time for transit vehicles to be properly cleaned, led to the need for changes to regularly scheduled transit services. New York City has had to adjust to the COVID-19 pandemic, and the MTA has had to change their approach to cleaning. The MTA has done this by discontinuing bus and train routes at times that are not typically busy, to allow for a more thorough sanitization process. In addition to these new intensive cleaning methods, cities also saw the need to maintain proper social distancing on transit systems while still being available for riders to use. The City of Houston, Texas changed its approach to the city's transit system as they added more trips to transit schedules in order to ensure that physical distancing measures can be followed. Changes to transit services has also been linked to fewer riders needing and wanting to take public transit. Transit systems in the province of Ontario have continued to offer services. However, service has been limited due to the lower ridership numbers. Reducing the amount of transit vehicles in operation can help to manage the amount of riders on transit systems and encouraging those who take transit to only do so for essential reasons. Transit systems in cities throughout North America have issued various regulations regarding personal protective equipment, or most commonly known as PPE gear. Items such as face masks, hand sanitizer, and gloves have been worn as a precautionary measure to reduce the transmission of COVID-19 in terminals or on transit vehicles. Some riders may not have adequate funds or access to PPE items. One innovative solution that transit systems in cities such as Washington, D.C. and New York City have implemented are PPE vending machines. The PPE vending machines offer free products such as face masks and hand sanitizer, ensuring that riders who are using public transit have the ability to follow public safety guidelines. Washington, D.C. was one city to use the vending machines, installing machines that provide riders with free masks in 10 different subway stations. The PPE vending machines have been largely implemented in subway stations. However, other cities, including Nevada's transit system, have installed similar devices that dispense free face masks on buses. PPE vending machines are a short-term solution that transit systems can use to help provide riders with tools to stay safe and help manage the spread of COVID-19. Why do we need to begin planning for the future? Many other aspects of the city's urban form are changing in addition to how we move around goods and people. As curbside pickup and online e-commerce have replaced traditional retail and commercial spaces, transportation stations and networks will have to adapt to this new model of business in the city. Similarly, the shift to remote working is expected to transform the way that office space currently occupies the city, indicating that commuter patterns will also be disrupted. This will likely have long-term effects on how transit systems are designed and what urban areas are prioritized. Finally, with the development of innovative transportation technology, such as rapid transit and autonomous vehicles, as well as emerging forms of micromobility, cities may see a decrease in congestion and traffic, allowing for the relocation of space to prioritize pandemic measures such as queuing, screening, and social distancing. Halifax must reimagine its public and private spaces to adapt to new demands on its public transit system. First, we will look at long-term designs for transportation stations. As history repeats itself, global pandemics are a driving force for redeveloping urban design and infrastructure capacity. The COVID-19 pandemic has created unprecedented times for both societies and economies. The growing impact on transportation systems has shifted from moving citizens to maintaining an operational transport structure to deliver transportation services to essential workers. These significant challenges have impacted revenue sources for many organizations in the transportation sector, causing many unexpected financial difficulties. Transit organizations must plan to ensure transportation networks will be equipped and prepared for future pandemics and for when full operations resume. Planning for long-term solutions in the transportation industry involves transportation networks continuing operations throughout lockdown measures, building strategic approaches for reducing operations, and sustaining an appropriate amount of capacity for individuals to practice social distancing and obeying public health orders. Transit stations must integrate new design principles for exterior and interior spaces to observe public safety measures and remove unnecessary transactions and areas that result in passengers having to touch surfaces. In doing so, terminals must replace old design principles with a new course of action in developing standards that entail proper safety protocols and hygiene practices. When redesigning stations, integrated physical distancing must be considered. To apply new physical distancing measures, stations must use distinctive materials and finishes that outline temporary barriers to guide passengers in performing physical distancing. Decals, large stickers, and tactile graphics are used at stations for indicating accessible routes, platform loading, and fare pay zones. Modifying these indicators can help mark the physical distancing length of 6 feet or 2 meters between passengers and highlight waiting areas for bus stops. Additional methods for implementing physical distancing are reassessing where seating and areas of gatherings are located. Benches and other seating arrangements must be designed to have removable seats, backrests, and material finishes that are easy to sanitize and disinfect. The pandemic has shed light on how many unnecessary physical transactions occur in transit environments. Passengers encounter many shared surface areas from arriving at a transit terminal to entering or alighting a vehicle. As new ideas emerge, touch-free technologies will become an intricate part of transit design, replacing shared surfaces with motion recognition and voice-activated commands. As contactless payment methods become more popular in urban centers, many cities are expected to move forward towards cloud-based transactions via individual mobile devices. These technologies will collect and share data with transit system networks, serving as a method of monitoring for station capacity during the pandemic. In building long-term designs for transportation vehicles, cities should focus on built-in measures that maximize social distancing and reducing contact. One proposal by design students from Shanghai, Hong Kong, and Boston illustrates what future transit vehicles could look like. The design proposes to combine exits and entrances into a single sliding door that allows passengers to move freely with distancing in mind. It also features alternating seat directions in copper-infused fabric that has scientifically been proved to reduce the spread of pathogens. Finally, the students suggest the implementation of stainless steel handles that use UV light technology to self-sanitize at every stop. Good ventilation also should be a priority in these new designs, as public health experts have linked higher coronavirus transmission with poorly ventilated spaces. Most public transit vehicles have the advantage of increasing air circulation by simply opening doors and windows. However, this might not be as feasible in the winter months, especially here in Halifax. One design adjustment that could fix this problem is already being installed in transit vehicle cabins in the UK. A company called Air Labs has created a device that cleans 95% of airborne viruses by circulating each vehicle with over 30,000 liters of clean air every hour. This could help commuters feel safe and return to using public transportation. In conclusion, public transportation is an essential component for city design, being a vital enabler of social and economic activity. As economies reopen and commuters return to public transit, The transit system must continue implementing guidelines to move through the response, reopening, and recovery phases of the COVID-19 pandemic.